a university of the first class. The Texas Constitution of 1876 called for nothing less. 5 years later, Texans chose Galveston as home to UT's medical branch, and Austin the site of its academic campus. Neither they nor UTMB's visionary founders could have imagined the shape of things to come. An academic health center that, for 125 years, has helped define and deliver on the promise of a healthier, brighter future for people near and far. An institution widely known for its commitment to community and service, its grit and boundless energy, and an innovative spirit that continues to redefine health sciences education, research, and patient care. Nowhere is that commitment to service more evident than in the generations of health professionals UTMB has educated since its doors first opened. The bright minds that come here aren't drawn by the ivory towers. UTMB students seek a hands-on connection to the people they will one day serve. Many take part in medical missions. Many more move on or return to communities in which healthcare is hard to come by. And they all understand the power of team and of an interdisciplinary approach to any challenge, be it improving the lives of patients suffering from traumatic brain injuries or better understanding the human genome.
I really had a desire to serve, and I wanted to serve at whatever capacity I could. Wherever that led me was here at UTMB.
For me, I love basic science and I love physiology, and when I first took a class in it, I just wanted to keep asking more questions.
You know, one of the biggest thing was that it was the first nursing program in Texas. I wanted to be somewhere that had ups and downs and was able to overcome adversity.
I like the curriculum because it focuses on a lot of self-learning, so you find your own deficits and then you really build upon that.
I feel like, man, I'm just gonna go for it. Doesn't matter, I'm gonna go ask that person the question because there's so much I can get. My bar has been set up way higher than what I thought it was coming in.
The difference I want to make as a nurse is I just want to put smiles on people's faces. I want to be the guy down the road that they tell their family about who was taking care of them.
I want to take this world-class education that I'm getting at UTMB and give it to underprivileged, underserved communities.
Being a part of the UTMB tradition of just changing the world in the littlest of ways to the biggest of ways. I just feel like I can now be a part of that. The healthcare industry needs people like me, needs people like us here at UTMB to make a big difference. And I feel like I can do that.
Any death is one too many. So said the Centers for Disease Control when Ebola began claiming lives in West Africa, and equally frightening here in America. Thanks to its pioneering scientists and specialized facilities, UTMB's ability to respond was without equal. University researchers helped lead the way in developing an Ebola vaccine, and its caregivers stood ready to treat any Texan exposed to the life-threatening disease.
Everybody probably remembers the Ebola outbreak that started in 2014. Our scientists here at UTMB have validated the treatments that were used to treat those people, and this saves lives. Dr. Tom Geisberg was named a Time Man of the Year for his work as an Ebola fighter last year. So we have world leadership in terms of infectious disease research with these deadly agents that come to our shores and represent a problem for people here in the United States. A neurobiologist, Giulio Tagliatella, and his group, working with transplant surgeons, have been working on Alzheimer's. They have found a drug that might actually slow the development of Alzheimer's disease. This would have implications for people in Texas and people across the country and around the world. These are really well-funded programs that are really pushing the boundaries of what our understanding of these diseases and which will lead to new therapies and ways of managing these chronic diseases.
Truman Blocker, UTMB's first president, had many heroes, including a fellow physician who was forever preaching compassion for the patient. Burn patients, mothers-to-be, people suffering from Alzheimer's or Parkinson's, Texas inmates, South Pole researchers, and trauma patients throughout the region. UTMB continues to break new ground when it comes to their care. It does so through first-hand knowledge of research breakthroughs, its broad network of healthcare facilities, including the newly opened Jenny Seeley Hospital, and a legion of skilled, big-hearted providers who want nothing more than to improve their patients' lives.
You know, some children want to be astronauts, others want to be paleontologists. The only thing I ever wanted to do was to be a doctor. UTMB took a major gamble in accepting a 17-year-old kid into medical school. I was very fortunate that UTMB accepted me. I've worked in the ER, I've worked in primary care, I've been chief of staff. I was the first chief quality officer for Driscoll from 2004 to 2007. All of these things have helped to give me an experience and an understanding of healthcare that, you know, many physicians go through life and never grasp. I consider myself very, very lucky. From what I've seen, every generation of students that we graduate seem to get smarter and smarter. It's amazing how outstanding these students are that are not only being accepted to the UTMB, but are being graduated. And you know what? I have every reason to believe they're going to do great things in this world.
UTMB and those the university serves have been blessed with the vision and dedication of generations who have worked and studied here, and with the transformational support of valued donors and advocates who believe in UTMB's continuing ability to work wonders.
In thinking about charitable contributions and where they should go, I think each person has to look back in their lives and think about, you know, what were the influencers? What got you to where you are today? What institutions gave you the opportunity to do what you've been able to do and to be successful? And how are you going to give back and pay forward? I would like to see the university thrive for another 125 years.
UTMB is the big boy on the block as far as I'm concerned, in terms of the number of physicians and the professional legacy that it leaves to the state of Texas.
I'm going to miss it because I've really developed the sense of collegiality that I love with my colleagues and with my mentors, and it's a really wonderful environment.
I've been here for 33 years, and I see great things for UTMB in the future. We're going to continue this legacy of excellence and contributing to the health of people in the future.